Now, I think it would be wrong to not actually start by discussing where we are with Plan B, not to Plan B. Both a lot of the Sunday newspapers were saying that some of them were saying scientists are saying that we must be in Plan B and that we're insane not to be. Rishi Sunak saying, well, no, we don't need to be because we've got these booster jabs. My point is, I don't understand why no one, journalists or anyone else, is asking the health secretary how on earth the NHS hasn't made arrangements to be prepared for this so that we had enough beds, so that we have the capacity.
Well, the first problem with the NHS, which came up during the original panic period, is that, and there's a very interesting paper prepared by the King's Fund, which anybody can read about this, is that the NHS has been short of beds for a very long time as a result of deliberate policy. It cut back on the number of beds, decided it would run much closer to capacity. That's what it does. And it's one of the many reasons why the National Health Service, which amazingly some people still believe to be the envy of the world, is constantly in crisis. And every winter, particularly, it enters a period of crisis. And when people say the NHS is going to be overwhelmed, I think you'll find quite a lot of people falling ill at the moment who would say that it was already overwhelmed, waiting for hours for ambulances to come, waiting when the ambulances do come, waiting in queues outside hospitals to get into hospitals. And this before any particular outbreak of winter illness, because the NHS simply is not very well run and it doesn't have very good capacity for this kind of thing, despite the immense sums of money which are spent on it all the time. And we're constantly told it's being cut back, but the fact is it is year after year after year after year, more and more money is put into it. So the reason cannot be the amount of money. It has to have something to do with the way it's organised. I do think it's time we stop worshipping the NHS. I do think it's time we looked at our neighbours on the continent who often have better health services than we do, in my experience and the experience of friends and acquaintances of mine who've been ill over there, and indeed of the French themselves. So, for instance, the French National Health Service does not anymore have wards. Anybody who goes into a French hospital goes into a private room, which seems to me to be a basic starting point for recovering from illness. We haven't achieved it. They got rid of wards years ago. Why haven't we done that? There are so many things that need to be said, but it's such a sacred organisation that any serious discussion of it is immediately put down as a sort of sacrilege. And I just think we should be much more open to discussing how it is actually organised and whether it's doing the job it ought to do. One has to put in here the obvious thing. The people who work for the NHS, and many of us have been rescued by the NHS, I myself, from a bad road accident, and I'm very grateful for the skill and swiftness of the care we got. But that doesn't mean that because we had a good experience, that cancels out the bad experiences other people are having, and we shouldn't allow ourselves to be silenced or to silence ourselves. That's the first thing on any NHS discussion that needs to be said. It's not as good as we like to think it is.
And a lot of our friends on the continent, they have systems, don't they, where you can choose the kind of care you want. You can choose the hospital you go to. And that brings in that word that I think people who love the NHS have complete horror when they hear it, and that is the sort of competitive nature of it. But that actually does improve services for patients. Now, I don't know, I'm not an expert, I don't know if that's going to actually solve things, but what I find frustrating, and it sounds like you do as well, is that whenever you even will mention that, go near that sort of word, people seem to have some sort of meltdown about it.
Well, there is a reasonable fear. People say, well, what we don't want to do is to copy the American system. And I agree completely with that. I lived in the United States for 2 years some time ago, and I lived very near a hospital. And I went down to check out what actually happened there. And in fact, in many ways, despite being fantastically expensive and requiring appallingly high levels of insurance to use it, it wasn't actually much more efficient than an NHS hospital. And the United States also does have a public healthcare system, but it's so heavily means tested that people really have to go through perhaps up at 60 or 70 pages of form filling before they can use that. Emergencies, contrary to myth, are treated. You don't have a credit card if you need an emergency, but nonetheless, it's not a good system. But it's not the only other way of organising a health service. There are many, many others. Canada has a reasonably successful so-called single-payer system. As I say, Germany and France and I believe Spain do quite well. I just think we should stop closing our minds to the possibility of reform I'm not so sure about this, the choice of hospital or anything else. There are, in fact, the policy of the past many years in this country of concentrating hospitals, having large district hospitals rather than lots and lots of small ones, would make that quite difficult. But I do think that it would be possible to provide a service, especially at the enormous cost that the NHS is actually bearing down on the population of this country, that would be better than one we have. And I do also dislike the constant assumption that because it's free at the point of use, it's free. We pay, all of us, however well off or poorly off we are, we all pay a very great amount of tax towards the NHS. It's not free at all.
And there will now be a national insurance rise. We heard last week that councils are asking to be able to put up their council tax as well as a precept towards social care. We're hearing today about the NHS getting this £6 billion budget boost. That's our money, by the way. I think all of that justifies conversations about what we do going forward. All of it does.
Yeah. But that's all I asked for, and I think that the Labour Party for many years pretended that it was the only friend of the NHS, and the Tories were dedicated to destroying it, which wasn't true. And the Tories have now sort of reversed that, so no, the NHS belongs to us now. We are the party that safeguards the NHS. I do think that it should be depoliticised from that point of view, and also I think whatever changes are made, they should be made with great care so they last. Because a huge amount of damage has been done to the NHS over the past 20 years by repeated reorganisations, which have not, in my view, helped very much, and in some cases have harmed. It shouldn't be a constant construction site, but there should be a really serious bipartisan, non-political re-examination of how it works and how it should work.